Some patient has a huge amount of Hill-Sachs lesion.
Yeah.
So in such a case, it's so hard to maintain stability even after arthroscopic Bankart repair. What is the solution for such cases?
When this lesion is bigger, then there is a need of repair surgery of the Hill-Sachs lesion also. So first of all, we repair Bankart lesion, then we repair for Hill-Sachs lesion.
How can you repairing the Hill-Sachs lesion?
With the anchor suture.
You mean Remplissage surgery?
Yeah.
For the anchor at point of the Hill-Sachs defect?
Yeah.
And repairing from the attached the posterior and superior part of rotator
Rotator
cuff,
cuff, yeah.
so-called Remplissage surgery.
Remplissage surgery.
Exactly. Yes.